Good afternoon, I'm Swami Iyer. I'm here with Dr. Venkata Battula, who is a PhD, who works with Dr. Michael Andreeff at the MD Anderson Cancer Institute, and he is one of the abstract presenters today. Very interesting and one of the upcoming observations in acute myeloid leukemia. His topic is AML cells gain growth advantage in the bone marrow microenvironment. Welcome, Dr. Battula.
Thank you.
So tell me a little bit more about your project. I mean, I guess you've been working on mesenchymal stem cells for many years, and what are the perspectives with respect to AML and the bone marrow microenvironment?
Yes, I do have experience with working with mesenchymal stem cells in Germany, and with that experience, I came to MD Anderson. So after joining MD Anderson, my research focus is now AML, bone marrow microenvironment, and MSCs do play a major role in regulating bone marrow microenvironment in AMLs.
Of course, Dr. Michael Andreeff is well known for all his work on the microenvironment.
So Michael Andreeff is my mentor, and then he has done several years of work on looking at leukemia stroma interactions and how do they regulate chemoresistance in AML. So
your question in this case and the hypothesis is?
So our hypothesis, my research area interest is to identify the right niche for AML microenvironment. In bone marrow microenvironment, there are several different cell types, including osteoblasts, osteoclasts, and endothelial cells, adipose cells. But we want to know, what does leukemia prefers? What is the right niche for AML cells? So for this, to address this question, we followed up the cell, a precursor cell for all these cell types, which is mesenchymal stem cell. Mesenchymal stem cells are known to differentiate into all these cell lineages like osteoblasts, adipocytes, chondrocytes, and also to some extent to endothelial cells. So if we follow up these cells, we will know the answer for which kind of a niche is preferable for AML cells.
And obviously the observation, it's not a big tectonic change in the thought process. It's both the seed and the soil. So obviously the AML is not the only bad cell. You have other cells in the microenvironment which are important, and you're saying the mesenchymal cells probably
That's absolutely right. That's absolutely right. So for the AML cell to grow, it needs some interactions with the neighboring cells. That's exactly what we want to find, which cell is more supportive for AML growth.
And you used mouse models to demonstrate?
So we used mouse models. We studied patient samples. So we extracted MSCs, mesenchymal stem cells, from patient samples, and we compared them to the normal donors, and we found major differences in osteogenic lineage. So like I said, mesenchymal cells can differentiate to multiple lineages, but AML-derived MSCs, for some reason, they are more differentiated towards osteogenic lineage, but not to any other lineage, for example, adipogenic or other lineages. So we have studied this in patient samples, and we also did several experiments in the laboratory.
So based on this observation that this program commitment towards osteogenic pathway might be important, so that's the observation, and you wanted to test it in mice.
Exactly, yeah. So we did that in the laboratory to see if it's really AML cell induced or to some other factors that induce osteogenic differentiation. So we did co-culture experiments in the laboratory with the normal MSCs, this time co-cultured with the leukemia cells, and that induced osteogenic differentiation as well. And then, you're right, we also developed animal models to see this observation in vivo, to validate this observation. So for this, we developed a novel mouse model where we implanted human bone, and then we injected leukemia cells. So now we are looking at interactions between human leukemia with human bone derived stromal cells in a mouse model. So and again, this mouse model also showed us that the bone marrow with leukemia has higher osteogenic activity compared to the bone marrow with a healthy bone marrow.
And obviously, what are the salient interaction findings or pathways that you found in this?
So we also studied mechanism, how leukemia is inducing osteogenic differentiation in MSCs. Two things came up. It's not just one direction, it's both directions. So the leukemia is creating its own niche because it needs some other factors that only that niche can secrete, and then the leukemia can take advantage of those factors and grow better. So what we found was that the leukemia cells secrete bone morphogenetic proteins. So these are BMPs, very well established for bone development and embryonic development. So these leukemia cells secrete these factors and induce SMAD1/5 phosphorylation in MSCs. That's how they induce osteogenic differentiation in MSCs, first of all. And once the cells differentiated to osteoprogenitor-like cell, then these cells are secreting back some other factors called CTGF. CTGF is a connective tissue growth factor, which is a known prognostic factor in ALL, but not much is known in AML. And we believe that this factor is helping leukemia grow better in the bone marrow microenvironment.
So the connective tissue growth factor seems to be the big component that's coming as a feedback to the AML cells.
That's right.
And any further experiments?
So both BMPs, we can also target BMPs. We can use BMP type 2 or type 1 receptor inhibitors to block BMP-mediated signaling. At the same time, we are also testing an antibody that is specific for CTGF, connective tissue growth factor. It's already in clinical trials.
So what kind of protein is that, if I may ask?
It's a growth factor. It's a secreted growth factor. It's involved in wound healing, especially for MSCs. It plays a major role in wound healing.
And have you gone back and looked at this growth factor in patients to see?
We haven't yet, but that's in our plans, in future plans. Definitely, we want to study this in patient serum if it's upregulated in AML patients and compared to the healthy
donors. If you do inhibit either the BMPs or the connective tissue growth factors in your model, do you see that the AML cells are not able to survive in that environment?
We haven't done that, but what we have, luckily, in the mouse is a CTGF transgenic mice that overexpress CTGF. So we have a wild-type mouse, and then we have a CTGF transgenic mice, and we want to see if CTGF has any role in leukemia development. So we transplanted leukemia, AML, in these both groups, and then what we found is much faster engraftment, rapid engraftment in CTGF overexpressing mice compared to the wild-type mice. That clearly shows that leukemia, CTGF is helping leukemia growth.
It's facilitating the AML growth. Any further insights?
So the next step is to target CTGF and then see if we can inhibit AML growth in mice, and we are also trying to inhibit BMP-mediated signaling.
Excellent, excellent. Are they small molecules? Are they monoclonal?
There are small molecule inhibitors for BMP signaling and antibodies, monoclonal antibodies to target CTGF.
Oh, excellent. I think that's a very good presentation. We hope to hear more from you, Dr. Battula. Thank you very much for your presentation. So this is the area that is of intense need for research, looking at the microenvironment, particularly in AML. Thank you once again.
Thank you.